Biobehavioral management techniques for controlling the overreactive hemodynamic state is presented by Dr. Robert S. Elliott, Chairman of the Department of Preventive and Stress Medicine at the University of Nebraska in Omaha.
The implication of biobehavioral management is that we balance both the pharmacologic and the behavioral forms of management for people. People who are normal, shown to be hot reactors, individuals who have various problems that require intervention, and also those who require rehabilitation for one reason or another. The importance of all this was first brought home to me, as I mentioned earlier, at Cape Kennedy, which was for me a real shock to be in a place that seemed to be so successful and to find that people were depressed, people were anxious, there was a high incidence of psychoneuroticism, and so forth. Probably the real basis for this escaped us early, as I mentioned, when we began looking for the explanations. We found all those emotions, and we found little in the way of risk factors to identify the people in question. To determine why it was that they had an incidence of sudden death 50% higher than any population of equal distribution in Florida, and to try to understand that during the time when people were fired, rather than when rockets were fired, was the time when sudden death was at its highest. The answers, of course, were those in which the individual was invisibly entrapped, in a way that they couldn't find their way out. They had lost control. They had lost their identity. It wasn't, as I said, a matter of whether they would be fired. It was simply a matter of when. When we do that to animals, they roll over and drop dead. When we do it to human beings, they often become anxious, depressed, and develop all of the metabolic and physiologic changes that we talked about in earlier segments. And so the question was, learning that, what could we learn that would help us more? The second introduction that I had to stress was when I first went to Nebraska some 10 years ago, and I was the new chief of cardiology. At that point, I was lecturing throughout the state, and 9 months after I arrived, I was lecturing in a small town in Nebraska on cardiac emergencies, and during the lecture, I developed one myself. This creates a considerable credibility gap for a new chief of cardiology. But it also created a lot of concern for me and seemed to reaffirm some of the impressions of my colleagues, in a sense, for I was supposed to be the child of a mother who was 88 when she died and a father who was 79 when he died. And the question is, how could I, at the age of 43, have an acute myocardial infarction with lineage like that? I've seen in the coronary care unit both sides of the sheets. The view from your side is certainly better. In my own case, I found my way out with the help of unbelievably good physicians who had common sense, and a remarkable wife who helped me every step of the way. And so what I've learned, I would hope to share with you, for I hope you don't have to have a myocardial infarction to understand what there is after myocardial infarction if you survive. Indeed, you don't have to be sick to feel better. As we address patients of the three categories that I mentioned then, how do we begin? Let's again step back and take a look at what we had as we went from one place to another. We went first, after Cape Kennedy, to Russia. The Russians performed an experiment in which they thought they would create nervous monkeys. For after they had lived together, the baboons that is, for about 3 years, they separated them, moved the original male 14 feet across the room in full view of the original cage. And then they moved a new male, the same age, in with the original female. Instead of producing nervous monkeys, what they did was produce all the diseases of the industrialized world. high blood pressure, coronary insufficiency, myocardial infarction, usually within 6 months, in the male monkey that had been moved 14 feet. Down at the bottom, you see the names of the 2 Irishmen that did the work. We next went to Finland, which has the highest incidence of sudden death and coronary disease of any country in the world, as many of you know. Along this point, you'll see the highest incidence of sudden death in the world. But if you drive through it, you'll also see the negative hallmark greeting card that the Russians have for the Finns. Tanks, barbed wire, the world's longest wall to hold people in. A new thing, 1,100 miles. A negative hallmark greeting card with German shepherds, machine gun nests, guard towers, and so forth that shows if the Russians cared enough, they could send the very worst. And indeed, they sit there all the time. Is it a sedentary person? No. The person most likely to have sudden death in Finland is a lumberjack. But there are other considerations. The lumberjack is unable to go up the social strata in Finland. He is forced to remain the way he is and where he is. And that is his life situation. For long periods of time in the winter, he's away from his family in a barracks-like situation. And then, after that period of time, he goes back to his family, but never to any better form of life. Again, a form of invisible entrapment, one in which the individual is not truly in control. They burn up 5,000 calories a day, far more than any of us could take without gaining tremendous amounts of weight. And yet, they're normal in weight. So physical activity for them does not protect them. But perhaps, we thought, it's similar to the situation we found in Germany, where von Holst had studied tree shrews that are of 2 kinds, hostile, aggressive male tree shrews, or the more passive type. They put 2 of them in a cage, one hostile and one passive, one dominant and one passive. And they separate them quickly before they do each other harm with a screen. And for several days, the dominant male hisses and growls at his more passive colleague across the screen. And within 3 days, 72 hours, most of the dependent or passive ones are dead of complications of high blood pressure, renal failure, and so forth. Not too different from what we see along the Iron Curtain, where we see Finland and Russia, where we see enemy to enemy, eyeball to eyeball, attempting to eke out an existence. And indeed, the farther you are, the Minister of Health told me, from the Russian border in Finland, the less likely you are to drop dead, statistically. Again, an oversimplification. We're looking for the reasons why that's the case, but we cannot overlook the fact that people eating the kinds of diets and smoking the cigarettes and doing the other things they're doing are doing it under circumstances in Finland on the border, different than they might in some other part of the world. So again, a nation, this time invisibly entrapped, not an individual, but nevertheless the same phenomenon. The struggle, the inevitable loss, the invisible entrapment. The typical day in the life of one of our forebears, busy day at the office, will not have to write away for a committee decision on the outcome of this event. Indeed, you'll either have a relative or you won't, based upon how well he solves the fight or flight dilemma. We were 2.5 million years in this situation. And it's only been in the last 300 years that we have been in an industrial setting. So if you want to look upon us as a group of highly bred individuals, mongrels, that's true, but nevertheless highly selected, we were selected out for a kind of existence that became less present in the world somewhere around 50 to 100 years ago. This kind of combat situation, fight or flight dilemma, determined whether you are here in this room or not. For if you didn't have a parent who could solve this problem, you're not here. And the same would be true of grandparents, great-grandparents, and so on, all the way back. I once asked my genetics professor, who was a fine German gentleman, is having children hereditary? And he stopped and looked up, and then he said, well, if your mother and father didn't have any children, you're not likely to have any either. And indeed, that is the situation depicted here. So the life we had before is one for which we were selected for survival. But that survival reaction, as we've discussed earlier, could be a suicidal one. Do we have time to create a new evolution of people? Probably not. But with brains, which we were given that are extremely good, if we use them, we can probably evolve a form of behavior that fits our times and is more appropriate. And that is our challenge, not only with sick people, but with well people. Now, this kind of thing affects us today. The old tiger may be in a suit with a tie, but the alarm reaction is still with us, and the invisible entrapment that we all feel from one time to another. And many of us feel that just when I knew all of life's answers, they changed all the questions. When we were in Russia, they pointed out that for every lifetime, we experience events in number that equal 1,000 lifetimes. And for every year we are alive, we have events that are equal to 1,000 years. The number of things that are done. This television crew has come all the way from New York to film this particular event. It would be amazing for me as a Nebraska farm boy, were I that, to have told my parents 50 years ago I was going to fly to Jackson Hole, meet a camera crew from New York, and I would be back in a few days. You know what they would have said? Here's one we better keep on the farm. He's not right. Now here we see again the difference between us and our forebears. On the left, one of our distant relatives, and you can see from his club he's had a good day. He's got a Guaiac positive club, got a little capital gains in the background, and the fellow on the right has probably had a Guaiac positive week. He feels that he's struggling against something and he's not winning. He doesn't know why. His system is uncoupled from what would be its normal counterpart. That is to say, the heart and blood vessels today cannot be coupled up with the muscles and skeleton because of societal inhibitions, because of the fact we cannot pick up a club and hit someone. And so that energy, which was directed outward through the muscles and skeleton in the past, is now directed inward. And the trauma is to the arterial walls and other components that we discussed earlier. The catecholamines and the cortisol and all of it flows in a way that we cannot resolve the dilemma. Indeed, we produce new changes in the body that are perhaps dangerous, since they cannot be dissipated. Is it type A? Gee, it would be easy if we could zip code people, but simply categorizing them type A or type B is the use of stylistics of speech, and perhaps does not have as much to do with whether they are at risk or as metabolism and physiology, and we've discussed much of that earlier. This was our role model for the last two generations, John Wayne. Certainly an enviable individual who, if he had a problem, would simply talk it out or slug it out. From our point of view, there are a few options to do that. Indeed, we like to watch Western movies. We like to watch football games because it's one of the things that is distinct between what we see as good and evil. Our system, though, provides the following. You are in our society what you work. Your identity is tied up to that. For the woman today who says, gee, I'm only a housewife, she's talking about where she works, where she lives. Her identity and her work are one and the same. For a man who says, I'm an executive, that's one thing. That's his identity. Take it away from him and he's at risk. And so we are taught long ago to struggle to the top of this pyramid, an abstract pyramid, not one that's terribly visible or real, but one that is definite. It is quite different from the pancake system of the Japanese, the difference between a pyramid and a pancake. For no one ever told you to be the second best. Try to be Avis. Don't worry about being Hertz. Always the charge was be the best, no matter what you do, but be the best. The Japanese work together very well in a group. Their philosophy is different. We can learn something from them, but we don't have to copy them completely. Well, stress then is something that piles up on us. It's sort of a process. Each of us has a platform of resistance, constitutional resistance, built-in behavioral resistance, and that platform is made up of a variety of planks. If a plank is weak, for one reason or another, it'll give in with the pressures of time. Could be labeled cardiovascular, could be labeled something else. But that piling up of stress gradually takes its toll. Here we see the difference between an individual's physical activity and response and his mental response. We see this person's treadmill tests, and you'll note that his blood pressure rose to a certain level there, which was fairly high, but not very high. It was normal. Yet when he was put through mental challenges, as we can see, mental arithmetic, cold pressor test first, his total systemic resistance, or peripheral resistance as it's labeled here, rose to about 2015, which is abnormal. And his systolic blood pressure went to 166/93, which is abnormal. And he was doing more in responding to that than he was to a treadmill test maximum. But more impressive than that was that this man was an accountant. He worked with numbers all the time. He didn't work with his hand in cold water. What do we see? We see here that his total systemic resistance in doing mental arithmetic was nearly double normal, and we also see that his blood pressure was 173/99, which is higher than it was sticking his hands in ice water. He does not live with his hands in ice water during the day, but he lives with numbers all day. And so the price this man was paying for his activities in the real world was far beyond that which we pay in an average treadmill test. Some people then go through their lives at 55 miles an hour with the brakes off. Some go through at 55 with the brakes on. And some go through at 55 with the brakes on and the engine burning up, the cardiac output falling, and so forth. But we have to realize then that the goal we have as physicians is to individualize the physiology, the life situation, the why now part of it, and then to custom tailor for that person a portfolio that will lead them into a productive and less self-destructive situation, no matter what their original limitations might be. First, if we're going to rehabilitate people, we want to change as little as possible. We want to realize that people are generally quite successful in whatever it is that they do, but that we have a couple of straws that may be breaking the camel's back. And those straws are the ones we want to lift off, the ones that really require our attention. We want to teach people to try on new behaviors as you would a new suit of clothes or a new dress. Realize that if it works, you'll wear it. If it doesn't work, you won't. And that all new behavior is acting to begin with until it becomes incorporated in a part of your own makeup. We want to take some lessons from the Japanese. I was not long ago in Tampa at the airport, and a group of Japanese got off an international flight, and they had their cameras and so forth, and they were nice to each other, and 11 or so of them literally flowed across the airport. And I would have given you $100 if you could have told the chief executive officer from this probably transistor company or whatever it was, from the rest of them. You couldn't. They all work together as a group. Keep in mind that it's very hard to be upset when you are bending over and not in a combat situation. Bending, bowing, and smiling. Keep in mind also that it's impossible to really get your physiology geared up so much even if you fake a smile. If you try now to smile, you change certain circuits that are set up so that it's very difficult to do that. Well, what about John Wayne? He said he's a little bit out of place in our society, for none of us can be John Wayne. It's even hard to be Jane Wayne today. But who is the John Wayne of our times? It's generally not an individual. We as physicians perhaps are not trained to work well in groups, but it is likely that groups are the way of the future, the John Waynes of the future. What do they look like? Well, they're a composite, but hopefully they'll look better than this kind of thing. The point is that we will have to make up the John Waynes from various components that we feel are important. Let's then stop and see things the way the human body sees them. Let's take a look at events. And as I mentioned, they by themselves don't have meaning. The brain processes that meaning. It decides whether there is a problem or isn't. It then prepares the body for fight or flight. And the body feeds back the information, we're ready, or we're overloaded, or we aren't. One of the first things we can do with ourselves and our patients is to eliminate unnecessary events. Not long ago, a procession was stopped in Omaha, Nebraska. It was a black limousine, a hearse, a German Shepherd, and 68 men in single file. The patrolman called them over and said, "Wait a minute, this is Nebraska, it's not California. We don't allow weird parades here." And the fellow got out of the limousine, he said, "It's not a weird parade." And the patrolman says, "Well then, what is it?" He said, It's a funeral. My mother-in-law died." And the patrolman said, "Well, that's ridiculous. What's the German Shepherd and the 68 men in single file doing?" And the man said, "Well, the dog bit her to death." The patrolman thought for a moment and looked up and he said, he said, "Do you rent the dog out?" And the fellow said, "Yeah, get in line." Now, the elimination of unnecessary events. I often tell my patients, supposing you had 6 months to live, you would have 3 things to think about. First, those things that you like to do. Second, those things you have to do. And third, those things you would not do at all. Now, when you go home to your room or wherever it is tonight, sit down and write down and play the game as if you had 6 months to live. And eliminate that third category of things that you would not do if you had only 6 months to live. You will then give yourself a little space. Creative time, time to do nothing, time to think about where you are, time to gain perspective. And that's very important to keep your circuits from overheating. We can also change the way we see things, and we can change them very quickly. For an event, as we said, by itself doesn't have meaning. The bottom line here is, I upset myself. And no one can upset me like I upset myself. It is the best job. I can make a mountain out of a molehill, but if I choose, by the same reasoning, I can make a molehill out of a mountain. It is then not the event, but it's my perception of it. And we'll talk a little about how that can be done later. We can also use a number of not only behavioral techniques to cool off the overheated neurochemical reactions from the brain to the body, but we can also use agents that will blunt the overreactive physiologic state as well, beta blockers. Those things which allow the messages of destruction that have gotten through the brain and limbic system to be blunted and sidetracked before they get too far. We can take heed from this particular lesson. Let us never overlook the feedback that comes from our dashboards. When we interrupt feedback from the body, we eliminate the wisdom of the body. And in so doing, we prevent the red lights from coming on in the dashboard of our car. That is a very dangerous phenomenon. Example, the patient with angina who doesn't pay attention to it is a patient who will have an infarction or possibly a sudden death. So biofeedback, that's one thing, but feedback is important. If you find you're not paying attention to it, or if your life situation is one of increasing headaches and so forth, pay attention to it, for this may be a problem. The problem seen on the human function curve here, where performance is always accompanied by arousal. That's normal. The question is not so much what you're doing, but how you're doing it. What price are you paying for it? Is it cost effective as it is up to this point? But beyond that point, what's happening? Sleeplessness, exhaustion, gastric discomfort, ill health, and so forth. The price at this point of arousal is not worth the performance. And that is the self-destructive part of it. Many of us have the impression that by pushing harder, we'll do better. But we each have to know, by listening to feedback, where the point is that we're getting the maximum bang for our physiologic buck. We also have to look at events. So many people think, well, I'll just get busy and do more. When the going gets tough, the tough get going. We've heard that so much. But the going gets tough as your circuits get overloaded. As they get overloaded from a telephone exchange, for example. You can only get so many signals and messages into that phone, into that exchange. And when our lives are cluttered with a number of events, we have to have time to sort them out. Holmes and Ray have pointed out that they have varying weights, that these weights can be given a number from 1 to 100. And that's fine, except that again, the perception of individuals of those events is quite different. Death of a spouse after a lingering illness may be looked upon as a relief, and certainly, even though it represents a tremendous change, 100 would be the maximum. But perhaps after a lingering illness, it would be less. And also divorce. We don't know until we know the individual. For some people, divorce is a disaster, and for others, it's a religious experience. And so we cannot decide numerically how each person will respond to it. But what we can decide is that each of these events requires our time for adjustment. Now, a lot of people where I come from think this is a modern California family, but actually this is where we all came from in the basic family makeup. And here we see it's pretty easy to know who the authority figures are, what the relationships are, and so forth. This is a modern Nebraska family, and any resemblance between this individual and your speaker is purely genetic. But in the world today, the person who is most stressed is today's woman. No question about it. It used to be us, the men, but today it's the woman. The reason? We ask them to act like a lady, think like a man, and work like a dog. In this situation, women become fairly angry, many of them. And they don't know exactly what course to follow, for there are so many courses to follow. But I often tell the men, you'd be angry too if you'd been dancing backwards for the last 5,000 years. Nevertheless, today's woman can have any of a number of identities. This was not true earlier. And today's woman is really a multiple role martyr. She could be a business person, a volunteer, a domestic engineer, wife, mother, and chauffeur. The ones we see with the problem are the ones that try to be all things to all people at all times. It is important that a woman learn to accept those things that she wants to do and to select those things she wants to do and to custom tailor her capabilities to the number of identities that exist in the world today. Imagine this woman who obviously is loved by someone. She has some nice gold bands, she has a cosmetics case, but she cannot show her face because of the society and the culture. And she also has a son who has a Western outfit here, a Jaws outfit, and a Mickey Mouse hat. Imagine the cultural shock for this woman, who indeed is not fully liberated and perhaps wouldn't be for many years. Also, she has many of the trappings and decorations that go along with Western civilization. Unquestionably, the increased choices that we see in women today have increased the anxiety among women. For any time you have a number of choices, you have a great deal of anxiety. And the problem is that every woman today had a middle-aged mother, maybe not terribly profound, but that mother came from a different world, from a different time, in a different era. She could tell her daughter values and give her a few things to live by, but there's no way that she could have seen the complexity and the number of choices that she would have as a daughter as compared to what that mother had. And indeed, the best advice we can give our women patients today is that it's okay to be what is okay with you, for none of us is wise enough to know just what the proper role model is in today's world. There are many. What about the typhoid Mary of stress? I mentioned the carrier type A, the person who walks into a room and spreads type A behavior like typhoid Mary spread her typhoid. Let us stop and realize that we can change the perception of individuals and events by a very simple system. Let me give you an example. We have learned to be upset by some person. Pick out that person who's in your mind and in your eye right now. That person, whoever the Godzilla is that you picked out, didn't take long. You've got him in mind right now. Now, supposing I told you that we had examined that individual and found that he or she has a brain tumor. And the brain tumor is responsible for the behavior with the mechanical pressure that is applied. That mechanical pressure produces the behavior toward you. It is not you particularly, but it is the behavior that is created by the tumor. If you knew that, and if you knew medicine, surgery, and radiation couldn't help that person, how would you feel? About 85% of those we've sampled would say, oh, well, I'd feel a little bit sad. And the other 15% would say, I wish the darn thing would grow faster. But whatever it is, for all practical purposes, the one you picked out in your mind has a brain tumor. It's a metabolic one, perhaps. It's not a real one. Maybe it's not cancerous. But it is a metabolic one. And if you choose to let somebody with a metabolic brain tumor upset you, fine. If you choose not to, that's your decision as well. The point is that each of us can decide the price we want to pay for a given event. Put them on the basis of a scale of 1 to 10. If you want to give an event a 9 or a 10 and really upset yourself, great, you can do it. If you want to give yourself a 2 or a 3, you can do that too. So essentially, it's your choice. You fix the price. It's not fixed in Washington. Another thing to keep in mind is that there are two kinds of people. There are thin-skinned people, as you see on the left, and there are thick-skinned people, as you can see on the right. Perhaps better to be a thick-skinned person. Why? Because when life's hammer blow strikes them, they bounce like a rubber doll. On the left, you see the thin-skinned individual. When the same life's blow strikes that person, they break like a china doll. Stop and think of it. Over here, everything gets a 9 or a 10. Over here, everything gets a 2 or a 3, and occasionally we all go to a 7, 8, or 9. We're only human. But not 30 or 40 times a day, as may be the common situation for the thin-skinned individual. Stop and think again. Why pay the price of hatred when a little dislike will do the job? Why pay the price of anxiety, a 9 or a 10, when a little nervousness will take care of the whole thing? Why suicidal depression, when a little sadness is enough? Again, you fix the price. It's your decision. Here is a memorandum or a memo pad from from an executive. This is a fellow who went through a complete physical and passed about 5 days before that at a famous Midwestern clinic, was given the Good Housekeeping seal of approval. And look at the self-talks that he was sending himself, which is another part of this whole issue. We are in conversation with ourselves all the time. We're saying to ourselves now, gee, I hope he gets through before my kidneys give out. We're saying, I wonder what the kids are doing, and so on. Those are self-talks or cognitions. And we have a tendency to believe that what we tell ourselves is true. But anytime you've seen two people in an argument over the same situation, each one believing he or she is correct, you know that not everyone can have true cognitions. Indeed, that's the basis for understanding the rational approach to cognitive restructuring. Changing your self-talks. But look at the heated up self-talks this person has. See the boss early. Rush. Look at all the messages he's sending up from the boiler room here. Cross off lunch, you're not human. Hurry, and so forth. Pronto. What's holding things up? Again, talking himself into being heated and hostile in every situation. Impatience, hostility, competitiveness. They all come through here so clearly. This person, by the way, after he wrote this, 2 days dropped dead. So the cognitions are self-talks. We need realistic goals, not the goals of our Mother's Bridge Club, those that we can live by. We also have to know where we're going, for if you don't know where you're going, you'll probably end up someplace else. We need to plan ahead. We need to establish priorities. Again, our own priorities, not anyone else's. And we also need these 2 rules to consider. First, don't sweat the small stuff. And second, it's really all small stuff. This is a word that most of us don't know. It's the most important lifesaver in the English language. To say no gives you more time and to eliminate category 3. It gives you time to be yourself. It gives you time to develop something that makes you feel fulfilled. But remember, this is a powerful way of making life easier. So say it often. Say it firmly, but gently. We need to decrease the frequency of life changes, for not everything deserves to be done in any given day. There are only a certain number of things that deserve to be done in any day. We need to simplify bureaucracy. When I was back testifying before Congress and then later at the White House last year, I was impressed that they were trying to do that. And so I sent them my own suggestions. Here it is. First, total income for 1981. Second, how much have you got left? 3, send it. So that there are a number of things that make up a custom-tailored health portfolio. The atrial fibrillation of events. As you all know in medicine, this is the irregularly irregular heartbeat. It is the unexpected in real life, and I often tell physicians that you plan your life so full from morning to night that you have very little time to stop and think about what you're doing and where you're going. So I suggest to physicians, why don't you take 20 minutes twice a day to do nothing? And they say, well, I don't know how to do that. Well, I said, well, take 20 minutes twice a day to see a fictitious patient. I'll even give you her name, Letitia Blimptickle. And I've got some doctors that are so driven, they come up to me afterwards and they'll say, well, what do I do if she doesn't show up? So the trouble with you is you don't know how to do nothing. You only know how to do something. And so it is important to close the door, take the phone off the hook, pull the shades down, tell your staff not to bother you, and try to locate your navel with radar. And, well, I don't think I could know how to do that. I don't think I could learn how to do that. Another game that's interesting to play is to ask a physician what the 4 components of play really are. And stop and think whether you know those 4 basics. Freedom, whimsy, spontaneity, and laughter. When was the last time you gave yourself a dose of that? If you haven't, remember, it's the 10W30 that makes the human wheels go smoothly. So find a place and find a way to do that. What kind of a vacation? Not long ago, in front of the Jackson Lake Lodge out here in the beautiful setting of the Tetons, we were just getting ready to start our program, and a fellow drove up with a New Jersey license plate. He had a station wagon in it, and there was sort of a brownish-greenish film over the inside of the wagon, and I don't know how many children were in there. He got out, he looked like he had terminal rickets, and I said, how long you been in there? He says, 39 hours. And I said, how long? He says, 39 hours. And I said, you mean all the way from New Jersey here? He says, certainly. And I said, did you see everything? He said, wouldn't miss a thing. Well, I said, did you go through Yellowstone? He said, certainly. I said, did you see Old Faithful? He said, it wasn't going when I went by. That is the we seen it kind of vacation, the kind that destroys families, it does not bring them together. I would suggest instead to my patients that they leave the kids with Aunt Minnie and that they take a 3-day weekend with that person who offers them love and mutual assistance. And often they'll say, well, I know what we'll do. We'll take the new nonstop flight that goes from here to Las Vegas. We'll see all the shows. We can come back and rest later. No, that's not what I mean. Well, what do you mean? I mean a 3-day weekend in the Christian Science Reading Room in dismal Seepage, Nebraska. And take some time for the 5 T's. Trust and time itself. Talk, touch, and tease. And those things help to establish and sustain a good relationship. Also have some life goals. For example, avenge yourselves. Live long enough to be a problem to your children. And remember that teenage is the closest thing to being psychotic without being institutionalized. Also, aerobic exercise, which moves the body through space, has got to be one of the best things for stress relief. For it decreases anxiety and depression and increases self-esteem. This is the way they do it in Europe, and here's the way we do it in the United States. We have to take into consideration these factors: lifestyle, climate, and the interests of the individual. Where I come from in Nebraska, we don't have a climate. We have a series of meteorologic catastrophes. And so what we do has to be planned and based on that. So each of us needs to prescribe for our patients a prescription for exercise that is based upon their capacity, as only you, the physician, can determine it. And it is not what we're doing, it's how fast our hearts are doing it, as you know, that makes the difference. But we can overdo the evaluation, certainly, of various individuals and things. And so this fellow really probably doesn't want to be a geriatric jock. He simply wants to be able to walk and talk with his wife in a social sense in a covered mall somewhere where the weather is not that good. And remember that the endurance that we gain by walking a mile is equal to that we gain by jogging a mile. And so as we grow older, it is that kind of endurance activity that we need. And if we can combine it with social activities, it certainly makes it more pleasant. Well, what about relaxation, yoga, and biofeedback? They're certainly good things in some ways if they're carefully selected. But can you see me selling this in Omaha, Nebraska? Well, the whole message then is, when you can't fight and you can't flee, we all have to learn how to flow. To slip life's psychological karate chops. To know that we are the ones that give events meaning. To know that we are the ones that upset ourselves and that we fix the price for how upset we want to be. And to know that we can work ourselves out of that as well as into it. It is certainly not all plumbing that we deal with in today's practice of medicine and cardiology, or surgery for that matter. But each of us in every way carries with us, no matter how high technology we deal with, the most powerful medicine that there is in the world today. It is that medicine which brought me out of the coronary care unit back to wherever it is I am today. And it was a physician such as you who cared to take the time to make my life interesting, productive, and less self-destructive. And that medicine, my friends, is the power of your words. And for that, I thank you very much.